Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, Nigerian hospitals struggle under growing numbers of coronavirus cases. A study from the country's Center for Disease Control suggests that around 1 in 5 people in Lagos have had COVID-19, well above the national infection official figures. Niger's ruling party candidate Mohamed Bazoum is provisionally declared the winner of the weekend's presidential runoff vote. Supporters of his rival take to the streets with accusations of fraud. And as the world rushes to source COVID-19 vaccines, Guinea launches an Ebola immunisation drive in response to a fresh outbreak that's already killed 5 people in the southeast. But first, a study by Nigerian researchers shows that over 1 in 5 people in Africa's biggest city may have had COVID-19. Tests of blood samples found that at least 23% of Lagos's 21 million strong population have been infected with the virus at some point. That's much higher than the official estimate of around 152,600 infections for the whole of the country. The discovery has ramped up the urgency for the arrival of vaccines in Nigeria. It's still not clear when that might happen. Samuel Okoye tells us more.
The COVID-19 antibody survey shows that 1 in 5 persons tested in 3 Nigerian states of Lagos, Enugu, and Nasarawa had been infected as at October last year. The survey was carried out by the Nigerian Center for Disease Control and the Institute of Medical Research. Key findings show that 4 million people in Lagos had been infected by COVID-19 as at October last year. The survey shows that Lagos alone had more COVID-19 cases than had been declared officially for the entire Africa. This might have to do with the low testing level in many African countries, including Nigeria. Between October and now, the number of COVID-19 cases have risen substantially. Facilities are overstretched on the ground. The survey shows that a large chunk of Nigeria's almost 200 million people are at risk of COVID-19. Basic protocols are not being maintained. People are not washing their hands. People are not using hand sanitizers. People are not maintaining social distance. The risk COVID-19 poses in Nigeria further highlights the need for vaccines. But for now, it is unclear how soon vaccines will be available in Nigeria.
Samuel Okoye there for us. Now, hospitals in Lagos have been struggling to keep pace with coronavirus infections. Numbers have been on the rise since December. With more than 21,000 active cases, private companies have been helping to ease pressure on the public healthcare system. Take a look.
A section of Marika Tajo's apartment has been transformed into a private ward, complete with oxygen canisters. She's recovering from COVID-19 and one of the people in Lagos receiving treatment at home. For her, it's been a source of extra peace of mind.
It was easy for me to ask something about what's happening to me, or at least update. Basically, it helps a lot psychologically because COVID is such a sad illness. Nobody can come to you.
The extra comfort, though, comes with a price tag. Private MD's treatments cost from $260 to over $13,000. The company has, however, set up a scheme to cover some of the fees for patients most in need. The home care service is helping to relieve some of the pressure on Nigerian hospitals, struggling to cope with an influx in coronavirus patients over recent weeks.
Some of us here, we don't even sleep at night because we have calls that we have to go and attend to. Some of us don't leave. We stay in the hospital 2-3 days, some 5 days.
During the first wave of the pandemic, Africa's most populous country was seeing less than 800 cases per day, but 1 month ago that figure rose to more than 2,300. It sparked a nationwide oxygen shortage. The demand in Lagos increased as much as 7-fold compared to autumn last year. Nigeria hasn't started its vaccination campaign, but officials say the first batches will arrive by the end of the month.
And Senegal kicked off its vaccination campaign in Dakar on Tuesday. It's using China's Sinopharm jab and says it will offer 10% of its 200,000 doses to neighbouring Guinea-Bissau and Gambia as a gesture of solidarity. For now, though, healthcare workers and those over 60 are at the front of the queue. Now, as the world rushes to source COVID-19 vaccines, Guinea launched an Ebola immunization campaign on Tuesday. It's in response to a fresh outbreak of the disease this month that's already killed 5 people. The cases center around the town of Guinea in the southeast. They are the first cases in West Africa since the 2013 to 2016 epidemic that claimed more than 11,300 lives in Guinea, Liberia, and Sierra Leone. 11,000 vaccination doses were delivered this week, and the World Health Organization plans on sending another 8,000.
After a dust storm delayed their arrival by 1 day, more than 11,000 doses of an Ebola vaccine touched down in Conakry, ready for the beginning of Guinea's vaccination campaign this Tuesday. The country has seen a resurgence of the virus in the last 10 days. 5 people have died.
Les vaccins vont être déployés sur le terrain, sur le théâtre de la riposte des opérations pour protéger les contacts des malades et encercler ainsi la propagation de cette épidémie qui préoccupe non seulement la Guinée mais aussi les pays voisins.
The World Health Organization has alerted 6 African countries since the outbreak in Guinea, the first return of the disease since the 2013 to 2016 epidemic that killed more than 11,000 people. Liberia and Sierra Leone have both raised their health alert levels. The Democratic Republic of Congo, meanwhile, began its vaccination drive last week. The country also saw a resurgence of the virus earlier this month, recording at least 7 infections and 4 deaths. It's a worrying trend for the WHO, especially given the circumstances.
Our collective quick action is crucial to avert an uncontrolled spread of Ebola amid the COVID-19 pandemic, which has already pushed health workers and health facilities to the edge.
First detected in the 70s, Ebola causes severe fever and, in the worst cases, unstoppable bleeding. With a fatality rate ranging from 25 to 90%, it is much more lethal than COVID-19.
Karis Collin there. Now, Hutu FDLR rebels have denied Kinshasa's accusations that they were involved in the killing of the Italian ambassador to DR Congo on Monday. Luca Atanasio died following an ambush of a World Food Programme convoy. Driver Mustafa Milambo and bodyguard Vittorio Iacovacci also died in the attack. No one's claimed responsibility for the shootings. Atanasio's body was repatriated on Tuesday. Congolese President Felix Tshisekedi paid his respects to the family of the ambassador. Italy's launched an investigation, as has DR Congo. Now, provisional results from Niger's presidential runoff vote have handed Mohamed Bazoum victory. Sunday's election was a race for a successor to outgoing President Mahamadou Issoufou. Bazoum, a former interior minister, is a long-standing ally of Issoufou. He picked up almost 56% of the vote to beat Mahaman Ousmane, who's also a former president. Clashes broke out on Tuesday as some of Ousmane's supporters cried foul. Shirley Sitbin has more.
This was one of the key moments in Mohamed Bazoum's rise to power. In 2019, the ruling party picked him to be its candidate in the presidential election. Him and not Mahamadou Issoufou, the sitting president who was about to complete his second term. This transition was a first.
Je ne me suis jamais imaginé porter un jour le lourd fardeau dont vous venez de me poser la charge.
Originally a philosophy professor, Bazoum turned to politics, founding with Mahamadou Issoufou what is now the ruling party, the Nigerian Party for Democracy and Socialism. For 3 decades, they were political allies. Throughout Issoufou's mandates, Bazoum held major portfolios, serving as foreign minister and home secretary. The opposition says that under the ruling party, people's rights to protest were violated. On these images, people who demonstrated against economic reforms were waiting to be tried. Although his rise to power is a transition, Bazoum plans to stick to the policies of his predecessor. Among his main challenges, the economy. 40% of Niger's residents live in extreme poverty.
Malheureusement, je l'ai dit, les recettes n'auront pas de résultats immédiats.
As the president-elect is set to take office, Niger still struggles with insecurity on 2 separate fronts. on its western border with Mali and Burkina Faso, where jihadists linked to al-Qaeda and the Islamic State group are active, and in the southeast, where Boko Haram has attacked soldiers and civilians.
Well, that's it for Eye on Africa for now. Thanks for joining us. Do so again if you can. Take care.